Hey, Dave O'Sullivan here. Now in today's training, what I want to talk about is what to do if you feel like you don't have enough time in a session, okay? So a lot of therapists that I've been very fortunate to mentor, and other therapists that have contacted me, they always say, I feel rushed, I feel like I don't have time, okay? I feel overwhelmed, okay? And that's absolutely fine, and that's perfectly normal. And that was definitely myself as well when I was starting out. But what I found over the years, that actual problem of feeling rushed is actually due to a lack of structure, okay? So the structure, what I mean by that is how the assessment to the treatment to the rehab, okay, flows. So the subjective to the objective, that should flow very nicely, okay? Now what I see a lot of therapists doing is they're asking questions in almost robotic form, okay? They're going through the motions. They've been trained in university to ask specific questions. They've almost learned off these questions, and it just comes out automatically. Whereas if you ask a question, okay, you should be able to make sense of the answer, okay? So again, when I was working with Huddersfield Giants, I remember we used to get students in and I used to ask them to assess a back pain patient, lumbar spine or knee. And all I would see is this monotone voice of rushing, okay? So they're getting the person to touch their toes, bend back, do all this. And I haven't even had a chance myself to actually look and make sense of that movement, okay, specific to that person. And that student was actually asking them to move on to the next test, okay? So when you do a movement, is there an understanding of why you're asking the patient to do that movement, and maybe a working hypothesis that you're trying to prove or disprove, okay? So once we get that flow from the subjective assessment, you ask questions to gain an understanding, okay, of that person. You gain an understanding of maybe some movement adaptations, motor adaptations that you may expect to see in the objective assessment. So then when you go through the objective assessment, this stuff should make sense, okay? So if someone is maybe guarding a certain part of the body when I ask them to do a certain movement and they're not happy to load a certain part of the body, how does that make sense to the subjective assessment? Because once you can start to have a rationale for every movement that you're doing and you understand how everything links together, then all of a sudden you'll cut time off, because you won't have to do every single textbook special test, okay? I can't remember the last time that I done a special test for a lumbar spine patient that didn't present with potential red flags, okay? So again, you need to be very clear on what you're trying to achieve, okay, with your assessment. What information are you trying to get out? But most importantly, how are you going to put that information to work, okay? So that information that you get from the subjective and objective assessment, that's the bit of information that you have to then put that to work in the treatment session. So that treatment then should start to undo some of these adaptations, more specifically back to that patient's story, okay? So the biggest trap that I fell down, certainly for the first 5 years of my career, was treating adaptations, okay? So again, I'd see something, decreased hip internal rotation, weak glute medius, let's treat that, okay? But I didn't ask myself the fundamental question, why? Okay? Whereas if you're always asking yourself, why is that patient moving like that? You're focusing your attention, okay, you're focusing and you're forcing your brain to give you an answer. Okay, so you're asking yourself, why is that glute medius not in a maybe good length-tension relationship to produce a good motor output? Okay, is it really the glute medius's fault after all? Okay, or is it how the body's adapted as a result of a previous injury that's now put that glute medius and a suboptimal length-tension relationship to be able to do its job effectively? Okay, so no matter how many times I stick my elbow or dry needle a glute med, it feels good initially, but then the pain comes back, okay? So all this understanding, this deeper understanding and having clarity, okay, which comes from your structure, that's the thing that's going to save you time, okay? And my assessments, they're very simple, okay? They're literally making sense of the subjective assessment, finding one or two peripheral tissues that I think are significantly contributing to that pain experience, and then finding out the reason why those tissues are contributing to the pain experience in the first place. And once we start to undo those specific to the person and their story, the magical things happen. It doesn't have to be complicated. We don't have to have a patient lying on the bed for half an hour doing massage, and they get up and they feel okay, they feel a little bit stiff from lying on their front for half an hour, okay? So you can have a very simple subjective assessment, objective assessment, make the changes specific to the subjective assessment and the story, and magical things happen, okay? So the next time that you feel rushed, just take a step back and ask yourself, why am I doing this movement? Am I actually doing this movement because I'm doing it out of habit, or do I actually understand what I'm looking for here with this movement, okay? Keep it simple, and one of the biggest things is overwhelm, okay? Overwhelm will stop a therapist getting great results, okay? So take a step back, keep it simple, and you'll be surprised how quickly things will start to make sense.